Hello everyone and welcome to my channel. My name is Anton. I'm a surgeon. I'm working in general surgery, oncologic, aesthetic and reconstructive surgery. On this channel I will be sharing insights about surgical procedures, techniques and treatments for various conditions. Today I want to show you one of the most elegant and advanced techniques for breast augmentation, endoscopic breast augmentation through the armpit. This method provides excellent aesthetic results with minimal scarring. Let's get it started. Normally, implants are inserted through an incision in the inframammary fold, around the areola, or in the axillary area. However, the endoscopic techniques allows the procedure to be performed with a minimal tissue trauma and no visible scar on the breast itself. How does this procedure work? How do we choose the right implants for each individual case? I will explain everything in just a moment. Before we dive into the operation itself, let's compare the key difference between the classic and endoscopic methods of breast augmentation. Preparation for surgery is not just about medical test, it's also about the careful individual selection of the implant, which plays a crucial role in achieving a beautiful, natural result. Let's see how this process works. Medical tests, complete blood count, biochemistry, coagulation panel to assess the patient's general health, breast ultrasound to rule out contraindications and analyze tissue structure, anesthesiology consultations. Choosing the right implant is a critical step based on several important parameters. Initial anatomical data, chest width, determines the maximum implant width, quantity and quality of soft tissue. If the skin and glandular tissue are thin, implants with a more natural profile are preferred. Skin and subcutaneous tissue thickness. Important to prevent visible implant edges. The patient discusses the desired breast size and shape with the surgeon. Special trial implants, known as scissors, are used to visualize the possible result. Based on patient's expectations, the surgeon finalizes the implant size, shape, surface type, and placement plane, subglandular, subfacial, or submuscular. Now, let's look at the technique of endoscopic breast augmentation via axillary approach. The procedure is performed under general anesthesia. The axillary and breast areas are carefully disinfected to prevent infection. 4 or 5 cm incision is made within the natural fold of the armpit, creating a tunnel to the breast. The surgeon creates a surgical tunnel by inserting a subcutaneous spreader to build a working space for endoscope. Dissection is performed along the course of the lymphatic vessels, blood vessels and nerves, minimizing the risk of damage. An HD camera endoscope is inserted in the creating tunnel. Carbon dioxide is insufflated into the working space. It helps to separate tissues, improves visibility and reduces the risk of vessels and nerve injury. The pressure is carefully controlled to avoid excessive tissue stretching. The pocket is created either under the pectoralis major muscle, subpectoral, or under the gland, subglandular, depending on the case. The endoscope allows precise visualization and minimizes the risk of tissue damage. Note the specialized endoscope. It's equipped with a camera and monopolar tip, allowing for both dissection and coagulation, enabling key steps of the operation to be performed almost single-handed. This directly impacts the quality and efficiency of the surgery. The implant is inserted through the axillary incision using a special device, the Keller funnel, which prevents skin contact and reduces the risk of infection. Once placed in the pocket, the surgeon manually adjusts its positions. The incision is closed with absorbable cosmetic suture. A compression bra is applied to stabilize the implant. Advantages and disadvantages of the method. Advantages. Preferred by the patients who want no scar on the breast, minimal trauma to the breast gland tissue, faster return to daily activities, lower risk of capsule contracture, endoscopic guidance, reduced complications risk. Disadvantages. Requires high surgical expertise, possible armpit discomfort during the first few weeks. Axillary scars may be more noticeable, while inframammary scars can be often be hidden under underwear. Recovery period. First 5-7 days. Limit arm movement. After 2 weeks, return to light activity. For 6 weeks, wear compression garments. 2 months, full return to regular activity. 3-6 months, final aesthetic result. Endoscopic breast augmentation through the armpit is modern method that hides the incision, minimizes tissue trauma and shortens recovery time. However, implant selection must be a personalized process based on the patient's anatomy and expectations. If you would like to learn more, subscribe to my channel, leave a like and drop your questions in the comments. In upcoming videos, I will discuss other surgical techniques.